I'm Dr. Bimlendu Kumar, intervention cardiologist from Jamshedpur Apurva Ishan Hospital. I will be talking today on the latest update in hypertension. As per WHO, there are nearly 63% of total deaths in India are due to non-communicable diseases, of which 27% are attributed to cardiovascular disease, which affects 45% of population in age group of 40 to 69. The raised blood pressure is among the most important risk factors for cardiovascular disease. Moreover, it remains poorly controlled due to low awareness about hypertension, lack of appropriate care through primary care, and poor follow-up. In India, the prevalence has gone up over 30 years to 38% in men and 32% in women from 29% and 28% respectively. Despite that, nearly half of the 50% of the men and 41% of women with hypertension were unaware of the condition. Additionally, over 62% of the men and more than 53% of women living with hypertension did not get treatment. Medications was used to control blood pressure in fewer than 1 in 5 men and 1 in 4 women with hypertension worldwide, as per WHO Lancet 2021 publication. International Society of Hypertension has released the ISS 2020 Global Hypertension Practice Guidelines. The inclusion of optimal and essential treatment paradigm attempts to address the issue that in resource-poor setting. Optimal care refers to evidence-based standard of care, and where essential standards refers to minimum standards of care to allow a specification of essential standard of care for low resource setting. The ACCHA has released a scientific statement in 2021 offering new guidance for management of stage 1 hypertension among patients with low ASCVD risk. Among low risk adults, that is no ASCVD or 10 years CVD risk of less than 10% with stage 1 hypertension, that is blood pressure of systolic 139 and diastolic 80 to 89. Management starts with non-pharmacological therapy. The blood pressure remains uncontrolled at 3 to 6 months, consider starting pharmacological therapy. ARDS is potentially fatal condition involving lung damage, and experts often associate it with severe COVID-19. A recent study which appears in Journal of American College of Cardiology report that metoprolol can reduce the lung inflammation and improve respiratory function in people with COVID-19 induced ARDS. Lowering the systolic blood pressure targets down to 110 to less than 130 range, substantially reduced CVD adverse event in step randomized trial, affirming the sprint findings for the older Chinese population. Among some 8,500 patients with age 60 to 90 years, 80 years in China, the intensive target trimmed 26% of composite CVD finding. From now, a second major trial supporting a lower target could unite the guidelines, which even among US professional society range from threshold of 130 to 150 millimeter mercury. With regard to prognostic value, ambulatory blood pressure monitoring and nighttime blood pressure, the 2018 USC guidelines on management of arterial hypertension recommend that diagnosis of hypertension should not only be dependent on office blood pressure measurement, but also out-of-office measurements such as ABPM or HBPM. So 24-hour and nighttime blood pressure were associated with greater risk of mortality and composite of CV outcome. Thus, they may be considered as the most relevant measurement for estimated CVDs. For every 20 by 10 millimeter of increment of blood pressure measured at night, the risk of mortality increases by 23% and risk of cardiovascular event by 36%. Most patients with hypertension require lifelong medical therapy to achieve optimal BP control. The 2018 resource European guidelines equally recommend 5 classes of treatment. The importance of combined treatment is particularly highlighted to improve adherence to therapy and BP control. Therefore, the 2018 European guidelines recommend, especially in context of lower blood pressure target, to start anti-hypertensive therapy with initial dual fixed combination of ACE inhibitor or ARB or CCB or diuretic. Since July 18, the products containing valsartan have been recalled worldwide. The reason is detection of NDMA, which can be found in candesartan, irbesartan, losartan, olmesartan, valsartan. NDMA has been classified as by WHO International Agency for Research for Cancer to be a carcinogenic in human. If 1 lakh patient would have received NDMA contaminated valsartan from Jinsheng, Huai manufacturing site where highest level of contaminant was found every day for 6 years in high dose, it could result in 22 additional liver cancers over a lifetime of these patients. The presence of NDMA in these drugs could lead to 8 additional cancer risk cases in 1 lakh patients if they had taken high over 4 years. Uncertain recall accompanied by significant increase in the rate of emergency department by 6%. The HYGI study representing the largest study that tested nighttime antihypertensive treatment. In this trial, chronotherapy was associated with significant reduction in endpoint. The HYGI chronotherapy trial tested whether the nighttime therapy in comparison to usual upon awakening hypertension therapy exert a favorable CVDs reduction. The largest study included a total of 19,000 hypertension patients. Despite during the average follow-up sequentially year, 70 to 50 patients experienced the primary CV outcome. An ambulatory blood pressure was performed in 48 hours to collect data on low, how BP differed during sleep. The relative risk reduction for CV event was significantly improved for nighttime treatment when compared with awakening treatment. Thank you.